Yeah, so first of all, I would like to thank BeLife, that is a project partner of B-THENET, in organizing this event and in providing support to discuss together with other persons that are in charge of the veterinary medicines regulation, so from DG Santé, from FVE, and even we will have some witness of how it works in some countries in Europe, from France, from Jean-Marie Hedon. And we will have the opportunity to discuss together about the topic of the availability of veterinary medicines in Europe. So everything started with the B-THENET thematic network. It is the first thematic network in Europe of beekeeping. And it is based on a multi-actor approach. This means allowing working together beekeepers, advisors, researchers, policymakers, exactly as we are trying to do today, to discuss best beekeeping practices, innovations in beekeeping. So the first question is why we discuss today about the veterinary medicines if the topic of B-THENET are best beekeeping practices. The reason is that we are going toward sustainability. The main aspect of B-THENET is focusing on sustainability. This means work with organic compounds that could be able to control diseases, especially Varroa. And of course, how can beekeepers adopt best beekeeping practices with organic compounds if they are not able to have them available on trade? And this is even the reason why in our project we have the International B-THENET Center that is coordinated by BeLife, that involves policymakers and involve even all other stakeholders that are active in beekeeping. So not only beekeepers, researchers, but even all those that are able to have an impact in the beekeeping sector, and in this case on the veterinary medicinal products. So the base of B-THENET is to work using a bottom-up methodology, and I have to say that since the first year of the project, the priority about the control of Varroa with organic compounds was specified by the European beekeepers. Okay, so here is the organization of our thematic network. We have 13 physical centers in Europe where you can find a place where beekeepers can exchange by person the discussion on the best beekeeping practices, and in the same time in the national B-THENET centers, beekeepers have available even beehives to test the practices and to discuss on them. We have even 3 international B-THENET centers. One is for other stakeholders that is coordinated by BeLife, as we already said, but we have even one international B-THENET center for beekeepers. It is coordinated by Apimondia, and we have 2 international B-THENET centers that are coordinated for the advice for veterinarians by the University Complutense of Madrid, and for the beekeeping technicians by the Sweden University. Even here, beekeepers and other stakeholders have their centers. The language here is the English, So it's something different by the national centers where the language is the local language. So beekeepers and advisors and everybody can easier access the discussion on the best beekeeping practices. But at the level of the 3 international B-THENET centers, the language is English, and it is very good because so we can even compare best practices from different countries, and we can even have the way to transmit outside Europe our results. And this is even why the language here is today the English. If you go on our project website, you can see that B-THENET website is organized according to different topics. The first is about the project, and the second one is about the platform. Indeed, we have 3 platforms. The one is to prioritize the practices. This is done through European survey for European beekeepers, so they can provide the priority of the practices to discuss in the network. Then, once that the practices have been identified, we have the exchange, that is the discussion among beekeepers, among advisors, and between beekeepers, advisors, and other stakeholders about the setup of the best beekeeping practices in different countries. This means that in each country we have specific practices that may differ from other countries because of different beekeeping equipment or different way to prevent or control diseases or manage the bees. And finally, we have the last platform, that is the repository. The repository platform is open access. All practices, once that they have been validated at the level of the different countries, they will be placed in the repository, and in this way it will be possible for everybody to access the best beekeeping practices and to use them even for teaching and training beekeepers, advisors, and so on. So everything started by the transnational event for stakeholders that you can see here in blue. It was organized by BeLife last July 2023 in Romania. And here we have the outputs of the meeting in Romania. There were 2 main issues that were related to the accessibility of veterinary medicinal products in European beekeeping. So the first was that it was not easy for all European beekeepers to have access to veterinary medicines for Varroa. And the second point is that we realized that a lot should be done for veterinary medicines that are registered in bees for the harmonization. And this is the reason why we decided to organize this event. So there is a new regulation, and it will be presented later by Dr. Las Heras, and about the veterinary medicinal products. And an important aspect is about the fact that the harmonization in Europe for the use of veterinary medicinal products may require some costs. And of course, we are worried because we don't want that the costs could make more difficult the access for beekeepers to veterinary medicinal products. So let's discuss today about which should be organized and what could be possible solutions to avoid higher costs. So one possible solution, but we will discuss this during the meeting today, could be to mitigate the costs for beekeepers of the medicines. by one side. To the other side, we should even guarantee, it should be even guaranteed that the beekeepers have access to the veterinary medicines. And what we saw with NOAA and with other beekeepers that have good, they have experienced good solutions in their country, is to promote a stronger link between beekeeping associations and veterinarians and other technicians to support accessibility to the medicines. This is another idea. We will have time together to discuss it today in this meeting, and I think that it's everything. We can go ahead with other presentation, and I don't want to take more time for my intervention. So let's have a final meeting after the roundtable to make a summary of the solutions that will be identified in the meeting of today. Thank you so much.
So thank you, Giovanni. So with this, we are going to go fast. I give the floor to Alfonso Laceras, that is also a veterinarian working at B-THENET and in the unit of animal health. And no, it's not animal health anymore. Veterinary medicines. Yes. Please, he is going to tell us, inform us about the regulatory tools that the veterinarians and we as citizens, let's say, have out there eventually to have access to veterinary products.
Thank you, Noah, for this introduction, and good afternoon to everybody. First of all, let me thank you for having invited us to this workshop. And also, please allow me to thank you for this work, which is very useful for your sector. I think that this network will allow you, everybody involved in the sector, to share your concerns, to share your reflections, and find for common solutions, to share best practices, things like that, which in the end will only result in the benefit of the sector. So today we are talking about availability of veterinary medicinal products in beekeeping, and what I have been instructed by the organizers is to tell you about which are the regulatory tools in the quite recent veterinary medicinal products regulation, which aim at increasing the availability of veterinary medicinal products for all animal species, and in particular for beekeeping. Okay, very good. So, as you might know, the current veterinary medicinal products regulation was published in 2019. It entered into application in January 2022, and it replaces the former directive. And I think that this doesn't escape the attention to anyone, that by being a regulation, which is a legal instrument which is directly applicable in all the member states without any need for transposition into national law, this provides for further harmonization at EU level, which is something quite positive. This slide, I wanted to include it in the presentation because it gives an idea of how EU law is made and who are the main actors in the process, and how complex the system is, because sometimes it could give the false impression that EU law is put forward by a few strange people in Brussels having nothing else to do, and this is not the case. Of course, the Commission has the right of initiative, so to make a proposal, but then those proposals are deeply discussed by the two co-legislators, so the Parliament representing the EU citizens and the Council representing the governments of the member states. They are looking at the proposals, they are putting forward amendments, and then in the end, if there is a common agreement, only in that case, then the piece of legislation is adopted by both co-legislators. For the particular case of the veterinary medicinal products regulation, just for you to know that since the Commission's proposal was adopted in 2014, it took us, everybody, 4 years to reach the finally adopted piece of legislation. Okay, so just to show that this is a very participative process where both member states and the parliament are involved. As you know, every time that a piece of legislation is revised, normally there is a number of objectives which are defined so that the specific provisions in the legislation at hand contribute to achieving those objectives. And in the case of the VMP regulation, of course, in addition to the classical objectives of ensuring a high level of protection of public health, animal health, and the environment, these 5 objectives that I have put in this slide are, let's say, somehow the most important ones. So, of course, one of the main objectives of this regulation was to tackle antimicrobial resistance, which is a major public health issue and which have strong links between the use of antimicrobials in animals and in people. Of course, we have the objective of increasing the availability of veterinary medicinal products, and that's a bit the objective of today's discussion. We also aim at fostering innovation in the, let's say, development and authorization of veterinary medicinal products, in particular by increasing the data protection period for the companies behind the doses so that they can, let's say, get fair return of the investments done. We also wanted to enhance the functioning of the internal market, and we will come back later to a number of provisions which aim at increasing this functioning. And of course, we also wanted to reduce the administrative burden for the pharmaceutical companies involved in the sector. Voila. So I just wanted to highlight that this is today's topic, to which we are going to come back very soon. So before going to the specific tools that the VMP regulation has in order to promote availability, I just wanted to make a few initial remarks for consideration, because I think this is important to keep in mind. So availability is a multifaceted issue which involves different actors, different processes, and for which there is no magic button which you just press and then you solve all the issues. So it's very much complex. So first of all, you have to consider which are the market needs, the needs of a given sector, which is the size of that sector, so that those needs become more attractive for the pharmaceutical companies in terms of making decisions on investments. So why to invest on products for a certain species and not for another one. Then you have different steps or different stages between the design of something and then when it becomes accessible or available to the user, in this case for the beekeeper. So you have the stage of innovation, and for that very specific stage there are some elements which are super specific about whether, let's say, academia is involved in some projects, whether technology transfer materializes, so that at the end we move from ideas to products which can be really placed on the market, and so on and so forth. But then on top of that, once something has been designed, if we want to place it on the market, we have the regulatory process, and that's something which is covered by our regulation. So you need that a pharmaceutical company brings this product to the market, and that's very important. But of course, once the product is authorized, you need to make sure that this product is widely distributed and it is accessible to everybody. And finally, you have also some elements on some constraints which are imposed by legislation regarding the prescription of those veterinary medicinal products by veterinarians and how those products have to be used. So we were talking about these multifactorial elements to be considered in the context of availability. And apart from what I just mentioned, something which is very specific for veterinary medicinal products compared to human medicines is the matter of affordability, because in the end, the price of the medicines has to be paid by the users, and there is no intervention of the national public health systems and so on and so forth. So I think that price matters, because in the end, VMPs are input for the farmers, for the beekeepers, and this is something which needs to be affordable. And finally, I wanted to mention something which has become more and more, let's say, frequent over the last years. And maybe you have heard talking about shortages of medicines, not for animals, but most probably for humans, for children, antibiotics, amoxicillin and things like that. But this may also happen for veterinary medicinal products. So we may have a very practical situation where innovation worked. Someone took the effort to place the product on the market, it can be distributed or whatever, but for whatever reasons, manufacturing, stocks, whatever, then in the end, when you need the product, it is not available. So it's a very complex issue in the end. So that's the very first thing. The second thing is that as I mentioned, as an EU regulation, of course, this piece of legislation brings a lot of harmonization at the EU level, but still member states may develop, for some parts of the elements covered by the regulation, national rules. And this is in particular the case of the retail of veterinary medicinal products, who and how the supply of medicinal products happens at member state level. And they also may implement some more specific rules regarding the implementation of the cascade articles. So moving to these regulatory tools in the VMP regulation, I have distinguished three different parts. The ones which are, let's say, oriented to the applicants, to the pharmaceutical industry, so to try to facilitate the authorization of veterinary medicinal products for beekeeping. Those which are linked to the distribution and retailing of veterinary medicines, and those which are more linked to the prescription and use. So among the first category, one of the key provisions in the regulation is that we have intended to reward as much as possible those companies which have invested in products intended for beekeeping. So they get the maximum of data protection. So what data protection means is that you have invested, you have produced data to defend your authorization. This data cannot be used by other competitors. So you get the rewarding by being, let's say, the pioneer of the market and getting back the money you have invested. So that's one of the key provisions. On the other hand, we have also foreseen that for limited markets, so species which have lower population numbers, the companies can also submit a reduced dossier. So that means that still, while the safety, the quality and the efficacy of the product may be warranted, at least this allows the companies to make a lower effort at the beginning until the first authorization is granted. And then on top of that, and this is a provision which aims at mirroring what has happened in the past, for instance, with the COVID vaccines, if for whatever reasons, and let's hope that nothing of that nature happens in the beekeeping sector, in case of need for emergencies and so on and so forth, there is also one provision which allows for a, let's say, fast-track authorization for this kind of medicines. You have already mentioned the specific problematics of small member states, and this is something which is well known. There are a few articles in the VMP regulation which facilitate that the labeling and the packaging can be multilingual, which means that the packaging and the labeling is valid for several member states, which reduces the costs for the pharmaceutical companies and facilitates that these kind of products can be put in different member states. Other than that, there is also a new procedure, a fast-track authorization procedure, which allows in a very short time period, around 60 days, to get a product which is already authorized in one of the member states, authorized in another member state. So this is something which is helpful, I think, for the beekeeping sector, because you are probably aware of some medicinal products which are authorized, let's say, in Italy or in Greece, but maybe not in Slovenia or in Lithuania. So these kind of provisions facilitate that there is a fast mutual recognition or authorization in a new member state. And just for you to know that beyond what is new in the VMP regulation, there are also some fee waivers, which means that for products which are intended for the so-called minor species or limited markets, then the fees which are charged to the applicants might be reduced. And in some member states, we know that there is a zero fee policy, so that this also helps the pharmaceutical companies to put forward applications for these markets. When it comes to the next link in the distribution chain, the VMP regulation has also harmonized further the distribution sector, the wholesale distribution, and one of the key elements is that somehow the marketing authorization holders, so the pharmaceutical companies within the scope of their responsibilities, have the obligation to ensure continued supply of the veterinary medicinal product. That's something which aims at limiting these shortages that we were referring to a moment ago. Then another important element is that the wholesale distribution authorization are valid across the EU, which what does it mean in practice. So let's imagine one of those multilingual products that we have mentioned a few minutes ago. So you have the same product with the language in French, Italian, and German. So then if that product could be supplied to the retailers from one single distributor who might be located in one of the three countries. So the authorization is valid across the EU, and then you no longer need that the authorization is granted by the individual member states for the distributors to distribute these medicinal products. And of course, there is a database in which you might find all the wholesale distributors which are authorized in the EU. Finally, this new regulation has also harmonized the parallel trade of veterinary medicinal products, which is something which might also help to increase the availability, but to some limited extent, because one of the prerequisites to do parallel trade is that the veterinary medicinal product is authorized in the two member states, the member state of origin and the member state of destination. And finally, we are almost getting to the end of my presentation. There are new provisions in the VMP regulation as well to try to increase the accessibility and the availability of medicines, and in particular the so-called cascade articles, which allow some medicinal products to be used outside the terms of the marketing authorization, provided that the required medicine for a given indication is not available. So under these provisions, you may also have access to VMPs authorized for bees in other member states. And if that was needed in the end, you could also have access to veterinary medicinal products which are authorized in third countries for the very same indication. The key element here is that, of course, any substance to be used under the cascade has to be a substance with which is allowed when it comes to the MRL regulation. So there should be one maximum residue limit, at least for one of the food producing animal species. So that's important. And I wanted to introduce one reference to this Union Product Database, which is referred to in Article 55 of the regulation, because this is the easiest way for you to search which products are authorized in beekeeping in the different member states. And I think that now we have a couple of screenshots. Yeah. So you can search in the UP database which medicines are authorized for each member state and for which animal species. And you can even search for the different pharmaceutical forms, whether this is for powder or whatever. So this provides you with quite a lot of information. So finally, one of the key elements as well when it comes to beekeeping is that Article 115 of the regulation provides the veterinarians with much more flexibility to set the withdrawal period when veterinary medicinal products are used under the cascade. And this is much more, let's say, fit for purpose, because under the former directive, there was no indication on how to establish the withdrawal period. And I think that we came to the end. So again, as I mentioned, the availability is a very complex subject, and cooperation between all the involved parties is crucial. The VMP regulation provides for further regulatory tools and instruments to increase the availability of veterinary medicinal products, also for beekeeping. And last point, but not least, I think that close cooperation between all the involved parties at member state level remains crucial, because maybe you still need to address critical limiting factors which might be country specific. And that's all. Sorry if it took me more than 10 minutes, but I think that it's important to have a good overview of these measures. Thank you.
Thank you very much, Alfonso. I think because we are in such a delay, there are not going to be questions. We leave them for the end, okay? So I would like to give the floor to Despina Iatridou. I hope I pronounced it correctly. She's from the FVE, so the Federation of Veterinarians in Europe, to actually have the use of veterinary medicinal products, the views from the organization, let's say, on this use of veterinary products.
Thank you, Noah, and thank you, all of you, for the invitation to join this discussion. It's really a pleasure to participate in this forum. So I would like to start with just a few words about FVE, the organization I'm coming from at the moment. So actually FVE is the Federation of Veterinarians of Europe, and we represent about 300,000 veterinarians in Europe, in 38 European countries. Members of FVE are national veterinary associations or chambers, and four sections, as we say, each one of which represents a vital part within our profession, and that makes the practitioners, the hygienists, the veterinary state officers, and the veterinarians working in education, research, and industry. So our mission is to enhance animal health, animal welfare, public health, and the environment. So we really have an One Health approach, and that includes all the species eventually, and all veterinarians, eventually the veterinarians working in beekeeping sector. We're trying to support veterinarians in their daily practice with the contributions we make in policy making, and with the right guidance on how to properly implement any legal provisions. And when it comes to veterinarians in the field, the practitioners, they have to exercise veterinary medicine according to their knowledge, according to their skills, but within the terms of specific rules that are set within the regulation, the legislation, the EU legislation and the national legislation. And whereas there are several pieces within the legislation that are relevant to veterinary services, we would say that there are two key pieces that are relevant for veterinary practitioners, and these ones are the regulation on transmissible animal diseases, the so-called animal health law, and the regulation on veterinary medicinal products and medicated feed that I'm not including in here. It's not that relevant for our discussion. And these two regulations are, both of them, they have within their scope bees and bee products, so that they are very relevant for us. So these pieces of legislation foresee that veterinarians must be the ones monitoring the bee health as they do for other species. So they have to advise the beekeepers about biosecurity plans, how to avoid disease, how to avoid spread of disease. They have to help them with disease prevention and with control of disease. They also have to help them with selecting the right medicine to apply, and this comes after proper assessment, diagnosis, and of course prescription of the right medicine. In addition, the veterinarians can inform the beekeepers about other obligations that are foreseen within the VMP regulation, like, for example, the record keeping. So bees are food-producing animals, and as such, they have to also keep a record on what kind of medicines they have been used. So the beekeepers have to keep a copy of the veterinary prescription, or in any case have to really keep a record when the date of administration is mentioned, the name of the medicinal product, the quantity. They have also to include when they applied and what the withdrawal period is, even if this withdrawal period is 0 days, and the duration of the treatment. And this is part of the overall responsible use practice within a part of responsible use practice in beekeeping. Another aspect that we have to consider as part of this responsible use practice is the reporting of adverse events. And this is adverse events, and this is a requirement within the legislation, considering the special role that the bee has for humans and for the environment in general for us. We understand how important it is not only to record the adverse events seen in the animals or in the humans, but also to the environment, and potentially any lack of efficacy. So it was mentioned by Alfonso that one of the aims of this regulation is to increase availability of medicines in the different member states. Apparently, bees are really in this sector. It's a minor species, and lack of availability is observed in several member states, but especially perhaps in smaller markets or in smaller member states. So this remains always a challenge still now that has to be addressed. On top of that, even if we have medicines authorized in different member states, that doesn't mean necessarily that the product is available on the shelf for use by veterinarians or by the beekeepers. So these are aspects that we have to continue to monitor and to strive to find a solution. The legislation, as said, provides some tools to tackle this kind of availability issues, like the off-label use, and already Alfonso explained that there are specific articles describing the so-called cascade, and the veterinarian can help there to identify the right product that is perhaps authorized and available in another member state. And if not that the case, perhaps he can prescribe a different option, like, for example, another medicine used for another animal species that is appropriately prepared for using medicines. But we have to be clear that this kind of homemade or off-label use has to be under veterinary supervision. And I also mentioned here the Union Product Database. It has been also mentioned by Alfonso because it's a indeed a very new tool provided by the legislation and allows to identify the different medicines authorized in the different member states. Still, it's in development, and we expect that it will be even more useful in the future, and also that it could give information about availability, real-time availability, like shortages. And this is something that we can keep as a note and always refer there. Very quickly, it's my last slide, and I close with this.
Okay.
Yes, this is. No, just one point. Yeah, it's that when we speak about not having available products, another issue and challenge that we face in practice is illegal internet sales. So if beekeepers do not have access to a product, they might go online and not for selecting a product authorized in another member states in EU, but could be that it comes from a third country, from unknown manufacturers. So this is really an issue that could be also an issue for public health as well. And we need to take that into consideration. And with this, I close. And my, let's say, take-home message, I would say that it is that apiaries need a veterinary supervision, and a veterinarian like pigs and cattle and other animals do. And thank you.
Thank you, Despina. So I think that's one of the reasons why we are here, and we are going to discuss today some a possibility of bringing veterinarians, which are not that many, specialized in bees, by the way, in Europe, closer to the apiaries. But before this, we are going to hear Andrea Gyorfi, who is also from the B-THENET group, let's say, tell us more about the comparison between the products that require prescription and the ones that not. So, Andrea, are you there?
Yes. First of all, I would like to say thank you to the colleagues at FVE, Federations of Veterinarians Europe, especially to Despina Iatrodu and Francesco Proscia for their help for all the discussions which preceded this analysis and data collection. So we used primarily the Union product database already mentioned during this session, and some data from another EMA database as well. What we would like to focus on, we have some numbers on the beehives and the beekeepers in the EU, but just to be more focused, I would like to go directly to our results. So what we found, these rounded numbers are not artificial. This is totally by chance. 60% of the veterinary medical products authorized for treating honeybees in the EU are non-prescription only medicine, and only 40% which is prescription only, based on the data got from the databases. And just a quick overview that the number of these veterinary medical products were usually, let's say, on average 15 per country, but there are huge differences from one single product to more than 20 products. And there is a, let's say, kind of geographical trend in which countries the products, or even the same products, are prescription only medicines or not. So now you can see the distribution by all the member states, and I would like to just highlight those asterisks next to the abbreviation for the country names. That means that in that particular country, more than half of the beekeepers are organized in beekeepers associations or members of in beekeepers associations, and more than half of the EU member states. In more than half of the EU member states, beekeepers are in such a ratio in the beekeepers associations. So maybe it's more easier to have an overview. So the number of prescription-only medicines in each member state authorized for treating honeybees we can see that, for example, most of such products are available in Bulgaria, 14, and then comes Portugal with 12 products, and Holland and Slovakia with 11 products. So only prescription only medicines. As for the active ingredients, they are more or less all the same all over the EU. The most prevalent are formic acid, oxalic acid, amitraz, flumethrin, and thymol. But there are huge differences also for the treatment aims. Most of these products are for the treating varrosis, and only in Bulgaria there are products authorized for treating nosematosis, or wax moth, or braula seca. And the number of non-prescription only veterinary medical products for treating honeybees in each EU country. So this is a kind of another kind of picture as the previous graph, and you can see the huge differences among the countries. And I try to also compare products which are seems to be totally the same, both as regards the active ingredient and as regards the packaging size, whether they are prescription only or non-prescription only medicines in the member states. And there are huge differences, as you can see. So we listed it according to the product name, not according to the active ingredient. That's important. So, and you can see the differences, that some products are, let's say, in a way equally, sometimes prescription only or non-prescription only products. Some products are prescription only in only one countries, and in other countries none. But I would like to add that in case of many products, we didn't have information available in the databases as regards the legal status of supply of that product. I would like to highlight also two differences. In France, there are some veterinary medical products which are subject to veterinary prescription except for some packet sizes, and in Austria, medicinal product of medical prescription for renewable delivery. So the veterinary medical prescription is not needed in each case in these countries, even if the given product is labeled as prescription only medicine. And as for the next slide, we collected the most let's say popular products available in Europe. So maybe the differences can speak for themselves even based on this slide. And as it was mentioned in the previous presentations, that the harmonization of the legal status of supply of these veterinary medical products are already should have been started or have started due to the EU legislation in power. And the most important thing what we should keep in sight is that all these products should be stay available on the shelves even during this transition period, during this harmonization period for the beekeepers. Thank you.
Super, Andrea. Thank you very much also for keeping the time and keeping it short, because that allows us to gain a little bit of time and have a little bit more discussion at the end. So with this clear difference in the implementation of in the practice, let's say, of the same rule, I would like to pass the floor to Jean-Marie Edon from the FNOSAT in France, who is going to describe how the French system works to improve and to maximize, let's say, the accessibility and easy the accessibility of veterinary medicinal products to the beekeeping. So, Jean-Marie?
Hello, everybody. Thank you to, at first, excuse me for my very bad English and my very bad pronunciation. Thank you to organize for inviting us to present to you how VMPs are distributed in France. So, in this first slide, I present you only the 13 medications that are authorized in France. First of all, I must clarify that no veterinary medicinal product may be placed on the market if it has not previously received marketing authorization. In France, it's named AMM, and this authorization is issued by the administrative authority. Only products with AMM are authorized, which is the case only if data proves the drug's quality, efficacy, and safety. So we have only in France 13 medications for beekeeping, which are presented in this slide. The first presentation precedent said that all these medications in France are out of form. And the presentation precedent said that it's not the case for some pack size. I don't know what size. For me, in France, no medication with pump. Medications are not over the counter. Only community pharmacy, veterinarian, or health groups are authorized to distribute medication, and for certain, under condition for veterinarian and health groups. For community pharmacy, it's their job. They can distribute all the medication for human or animals with prescription or not. Veterinarian can distribute medication only after physical examination, or if he has with the beekeeper a health monitoring with care protocol. And regarding the health groups, I will present to you who they are, what their obligations and constraints are, what their benefits and drawbacks for beekeepers. Health groups are named in France GDSA, Groupement de Défense Sanitaire Apicole. Those local beekeeping health organizations are allowed by law in 1980 to help and support state veterinarians. They are local non-governmental organizations. They are accredited by the administration. They contribute to the beekeeping sector, perform livestock health supervision, and make VMP available to beekeepers, ordering, stock management, and distribution. And these health groups can distribute VMP only if they have a livestock health program. In France, it's known PSE, Programme Sanitaire d'Élevage. 80 GDSA with PSE in 76 departments have an approval. 80 GDSA in 76 departments. PSE are regulated by law, so some constraints. A detailed case field must be submitted to the administration, and this field must describe who will be responsible for dispersing VMP. Must be a veterinary or a pharmacist. The disease against which the group wants to fight. Only varroa for beekeepers, because no other medication apart from those used for varroa control is authorized in France. Antibiotics are strictly forbidden. Donc, this field must describe the list of VMP and their specialty name that the group intends to distribute and how they will do that. Who will keep the stock of VMP and how and when VMP should be used. GDSA are allowed to distribute VMP only to their members, and these agreements are valid for 5 years, and 100% of beekeepers in the group shall be inspected in this span of time. Health groups can distribute VMP only to their members. The benefits for beekeepers. The first benefit is the cost of VMP for beekeepers due to the economy of scale. Advice from either veterinarians or clinicians during regulatory visits. Technicians, TSA, Technicien Sanitaire Apicole, is a qualified beekeeper after a special 7 days training in beekeeping health. During this formation, they learn bee disease, how to recognize them, the regulation of some of them, the veterinary pharmacy applied to bees, what to do in the event of illness, and samples to be collected. For beekeepers, it's also support and training to beekeepers about bee health, how to use VMP and how to have better beekeeping practices, possibly visit colonies to detect disease and collect samples, bees, brood, or also health, and in fact check that beekeepers comply with regulations, annual declaration or apiaries, beekeeping, keeping of breeding register. Some figures, but each GDSI is independent in its operation. So I don't have general data, but only approximations. And I can give you, if you want, the real cost in my GDSA, for example. What's the cost for the group GDSA? It's a veterinarian or pharmacist responsible. It's between 1,000 or 5,000 euro per year. And the cost is also the visits of beekeepers by technician or veterinarian, mostly travel expense on short distance. And around 1,000 technicians can do these visits, mostly volunteers. What's the cost for beekeepers? Membership fee, some difference between departments, but generally cheap for backyard beekeepers, less than 50 euros per year, and between 100 and 200 for a professional beekeeper. And this example between the 100 and 200 is for a beekeeper who have 400 hives. If he presents 800 hives, the cost is nearly the double, perhaps 180 and to between 180 euro or 280 euros. The advantage is reduced price for the VMP between 15 and 30% discount on VMP. Some stats, extrapolation from data available from 40 groups. For Apiva, for example, 130,000 euro. Apitraz 40,000. Famicro 2, it was 40,000 euro in 1 year. And what's the role of NOSAD, qui est une fédération of departmental health organization. NOSAD is non-profit and non-governmental organization aiming federating local beekeeping health organization. In 2023, it was 80 departments out of 96. And FNOSAD carry out studies to monitor for the effectiveness of treatments and resistance studies, and support departmental bee health organization in completing the livestock health program, provide groups with a software in order to manage members, bidding, VMP ordering and distribution. 40 department organizations use this tool, and in finish, publish and distribute reference manual for a small fee. This last slide is the last one. Thank you.